This is the AccuGuide box in which the cable is inserted. To this AccuGuide cable we attach the leads. This is a 50 mouse unit botulinum toxin vial made by the Allergan company. The surface electrodes are now stuck, as mentioned earlier, over the skin of the mandible, on the right side in this case. Now the Teflon coated needle, which is a very thin needle, is also inserted into this AccuGuide cable. For male patients, the tip of this needle is angulated at 30 degrees. For females, it need not be angulated. Botulinum toxin is prepared fresh on the day of injection, and in a 50 mouse unit vial we inject 2 cc of saline which has not got any preservative in it. The Botox is gently rotated and not shaken vigorously, and a tuberculin syringe is used to aspirate the amount which has to be injected. Usually in first time patients we inject 0.1 ml, which is 2.5 mouse units. The needle is now being passed through the cricothyroid membrane about 1 millimeter from the midline on the right side, directed 30 degrees laterally. The patient phonates and we get a signal of action potentials as seen on the screen over here. And this confirms that we are in the thyroarytenoid muscle, as every time the patient phonates, we get a burst of signal on the screen. The same procedure is repeated on the opposite side when the electrodes are now put on the left side and the injection is introduced through the cricothyroid membrane 1 millimeter from the midline onto the left side. The needle is again angulated 30 degrees laterally. Once again the patient is asked to phonate. Aspiration prior to injection is always advised, and during injection the patient is advised not to swallow, cough or move. Once again we get the burst of activity when the patient phonates and says E. This is how the screen looks when an EMG is in progress. On asking the patient to phonate, we get this kind of a spurt of activity, which is known as the full interference pattern. This is a laryngeal EMG being performed on a patient with a conventional EMG machine. Over here, the position of the patient is in a lying down supine position with extension of the neck. Some laryngologists prefer a sitting position with the neck extended, as was shown in the previous clip with the AccuGuide system, and some laryngologists prefer the patient in this position. Over here, the 27 number needle is slightly thicker than that available with the AccuGuide system. The rest of the procedure remains the same.